Okay, so the first mobilisation that I'm doing is a PA glide of the MTP joint. I'm going to use the first MTP to demonstrate. Patient position is prone. Reasons we do this test are we have a lack of mobility. First MTP is important for gait, especially the pushing off period of gait. We're going to need that toe extension. Perhaps it's painful for the patient. Maybe they were in a cast and they're just lacking overall mobility of those joints. The PT position, we are going to stabilize the metatarsal of the MTP that we're going to work on, and then the thumb is going to provide the mobilizing force to the MTP, and then we are going to move in a posterior anterior direction, and we are looking for pain relief, so change in symptoms to know that this mobilization is working, and we're going to use an appropriate grade based on that. This special test is Kleiger's external rotation. We would use this test if we suspect a high ankle sprain of the syndesmosis or a medial ankle ligament such as the deltoid. There's two different ways we can do that. The patient position, they're going to be laying on the table with their leg just off it, so we have access to the ankle. The PT's position, we're going to stabilize the lower limb on the tibia here to test the deltoid ligament. We're going to have the ankle in neutral or perhaps slight plantar flexion. We're going to grab approximately the calcaneus, and then we're going to externally rotate the ankle. Positive test for deltoid ligament sprain would be if they have pain at the medial aspect of the ankle here. If we're going to test for the high ankle sprain, the syndesmotic sprain, then we are going to again stabilize the lower limb at the tibia. We're going to put the patient into dorsiflexion and then apply that external rotation. And what we're looking for here, the patient would report that was painful on the anterior-lateral aspect of their ankle, and then that would indicate the high ankle sprain. Okay, we are going to demonstrate the Thessaly's special test. This is a test that you would perform if there's a suspected meniscus tear to the knee. They could be experiencing joint line tenderness or locking and catching sensation, so this would be one way to test the meniscus. The PT position, you're going to stand in front of the patient and you're going to support them with one of your hands, and then the patient is going to stand on one leg and put about a 5-degree bend, so a really soft knee, and they are going to turn to their left and then to the right approximately 3 times. What a positive test here would be that that's painful or they're experiencing a locking or catching sensation. We'd also want to do the uninjured leg first so we can get a baseline for that. Once they've done that, the patient is then going to increase the flexion of the knee to about 20 degrees and then perform the same turn to the left and right 3 times. Again, the provocation here we're looking for is pain, and locking and catching sensation would indicate a positive test and potentially a torn meniscus. The joint mobilization that we're going to demonstrate is internal rotation of the tibia with active movement. That active movement by the patient is going to be them flexing their knee. The reason we choose this is for pain relief if internal rotation of the tibia is a painful movement, or if that movement's restricted. Another reason why we can assist in the locking and unlocking mechanism of the knee with the internal rotation of the tibia. Patient position is going to be hook lying on their back, and the PT will flex the patient's knee to their limit, and then we're going to come about 15 degrees from that limit. We then apply an internal rotation force to the tibia and instruct the patient to actively flex their knee. And then we are going to passively extend it back to that 15 degrees and ask them to do it again. And we're going to continue this rhythmically until we have pain relief from the patient.